ERC Channel 2. This is Houston Newsmakers with Cambrell Marshall.
National Doctors Day is right around the corner on March 30th. In Houston, we are surrounded by some of the best doctors in the world, some who are making strides in the fight against breast cancer. This morning, the link between breast cancer implants and a rare form of cancer. Just this week, the FDA says at least 9 have died. The cancer is called anaplastic large cell lymphoma, an extremely rare malignancy of the immune system. The FDA has received nearly 360 reports of the cancer in women with both saline and silicone breast implants. Here in Houston, we have a doctor who focuses on this type of cancer. Joining us this morning is Dr. Mark Clemens. He is an associate professor of plastic surgery at the University of Texas MD Anderson Cancer Center. Great to have you here with me this morning.
Thanks so much for having me.
So can you explain this phenomenon of a lymphoma caused by breast implants?
Sure. So in 2011, the FDA came out with a safety communication, much like what we saw on Tuesday, saying that there was this disease and that it can occur. And it's a lymphoma that can develop around a breast implant. This is very similar to previous updates, one in 2011 and also one just last year.
How rare is this?
It's very rare. So if we look at a risk to women, it seems to be about 1 in 30,000 lifetime risk. And that's a little bit more focused based on the FDA report we saw on Tuesday. They really focused it down to a specific type of implant called a textured implant.
So this is not breast cancer, correct?
This is not breast cancer, and that's an important distinction because breast cancer affects 1 in 7 women. This is much more rare, and that's important too because a lot of women receive breast reconstruction, and it's not related to breast cancer.
So if it's not related to breast cancer, then how is this particular condition treated?
So it's actually treated with surgery and surgery alone in the majority of patients. It has a very good prognosis, and it's important for women to realize that it does exist, it's rare, and if they get a symptom, which is an unexplained swelling of the breast or a fluid collection, they should go see their doctor. And that's the message that we're trying to convey to women.
So should all women with breast implants be concerned about developing this type of condition?
So they should know about it. I think that they need to be realistic that it does exist and to look for the symptom if it does occur. It's important that the FDA did not restrict implants or call for them to be taken out. What they said is to know about it and go to your doctor if you see the symptom.
So you said that a course of action for treatment would be surgery. What kind of recovery does that entail and what goes along with that surgery?
So the surgery for confirmed cases usually means removing the breast implant and the capsule or the scar tissue around the breast implant. That can take about an hour procedure and recovery is about 1 to 2 weeks. And again, that is curative for the majority of patients.
What research is being done right now to learn more about this?
Well, I think the most important question that everybody wants to know is why is this occurring and how does it occur? And is anybody susceptible to this? We don't think so. We think that there is a certain subset of the population that for whatever reason, genetics, might be susceptible. And so we're trying to figure that out in our laboratories at MD Anderson Cancer Center.
What kind of questions should women who are thinking about getting breast implants be asking their physicians?
So this discussion should be part of any discussion that a woman has with their physician that is contemplating receiving a breast implant. And that's for cosmetic or breast reconstruction reasons. They should realize the risks and the benefits, the types of implants out there, smooth versus textured, and they should understand the symptoms of a complication occurring. That's all part of good breast health. They should also understand checking their breasts, mammography, going to see their doctor if there's a problem.
So certain women may be more susceptible in terms of developing this type of condition, but it's hard to say who falls into that subset.
Exactly. That's exactly what our research is focusing on right now, and hopefully we'll be able to come back and have more information. But this FDA report was a big leap forward.
And certainly there's always more work to be done on this front.
Exactly.
All right, Dr. Clemens, appreciate it. Thank you so much. Don't go away. We'll be right back. We'll have more Houston Newsmakers next.